join me today to have this conversation on Scribeberry and its journey so far. So I know Zaahir, you're a GP, family doctor.
Correct. Yes. Yeah.
Oh, okay. And Aman, and you're an engineer, if I understand correctly.
Yeah, like I worked as a software designer slash engineer for many years. Yeah,
Okay.
before.
Oh, okay. So, the way I like to start this is just to understand your background, what drove you both into um, developing such an innovative tool like Scribeberry. It's exciting for me because I get to interview two co-founders at the same time, It's usually just with one and so on. So this is great. I get to get, kind of two perspectives.
Yeah.
So, either of you can, just start by, telling, what your experiences have been in the past, like where, if you've worked on any other projects and so on, that you feel that also just prepared you to be able to launch a product like this.
For sure. Aman, maybe go ahead.
Yeah, sure. So a couple different things. So like I said, I worked as a software designer slash engineer. So I was on the tech side a lot in my career.
Yeah.
But that being said, my family actually ran some orthopedics clinics.
Okay.
Like basically since I was born, and so I was always surrounded by like healthcare.
Okay.
So I would always be like their like tech support just to make sure that everything is working there, setting up their EMRs when EMRs first came out. So I guess my interest in tech and healthcare started at that point.
Okay.
But then specific to Scribeberry, so my wife is also a physician.
Yeah.
It's something that she does quite often, documentation, and so I saw it at home, kind of that struggle that she's been having. But then also myself and Zaire have been like very close friends.
Okay.
We play soccer together, and
Ah.
she's been a physician, and so he's the one that actually came to me with the idea for Scribeberry.
Yeah.
But I was kind of dabbling back and forth in a different like field in medicine.
Okay.
Another product called MedFair, where I basically created a wholesale marketplace, and I
Okay.
was dabbling into the AI space at that time. But that's kind of what brought me into it. But I'll let Zaire speak a little bit more on the actual Scribeberry journey, because I think it really owns in with what he was going through.
Oh, okay.
Yeah. For me, I was a new grad out of residency, and I started a practice right away.
Yeah.
It was outside of Edmonton, a few hours, but I had a large patient panel, 1,800 patients or so.
Wow.
And what burned me out of that practice was not so much the clinical work, but it was the paperwork and the admin burden,
Okay.
especially when COVID hit around that time. And so through that process, I was kind of thinking about this as a problem, and
Yeah.
initially created like a no-code tool, very
Okay.
similar to Scribeberry. In fact, it didn't have the AI scribe at that point. It had more like, macros and automation and like different workflows.
Yeah.
But that was the original concept. And then, when kind of AI grew a little more popular, it was pretty, like, to me, it was like an aha moment where I was like, okay, we got to do something.
Yeah.
And so I went to Aman with that idea.
Yeah.
And so that was the start of Scribeberry. And initially we launched it for free and got like such like great feedback that
Feedback.
we said,
Okay.
"Okay, we should probably
Amazing.
launch this as a product." Yeah.
Yeah.
Okay. So when did you guys launch it?
Officially, I think it was April 2023.
Okay.
Yeah.
Okay. Because I know the past year has really, I mean, maybe slightly before that, but the hype around AI Scribe has been in the past year. So it's also good to know that you guys were. This is something you've been working on, way before beyond that. You did your market research. You understood the pain point. You're a physician yourself, Zaire. So one other thing that I notice is that some of the tools that I work with or I implement with physicians are not always founded or developed with a collaboration of, like, I don't always have a physician as a co-founder or a founder, now I'm starting to see that, but I'm guessing that having your perspective as a physician yourself, do you see that that brings a different perspective to the team working together with Aman to produce a product like that?
Yeah, I mean, I hope I'm valuable, but I think it matters because as like from our end, we try to focus on like, okay, workflows that cause pain, that take up time.
Yeah.
For example, form filling or yeah, other areas that just take long for, let's say, me or other clinicians to use. And so I think anytime we make any product improvements or changes, like that's always, our focus. Like, does this actually solve a problem?
Yeah.
And so I think there's value there for sure. Yeah.
Yeah,
Okay.
it's been like invaluable, to be honest. Like, I mean, like the fact that that Zaahir is like the co-founder. I mean, just watching his day-to-day workflows. Even my wife, just watching her kind of like work and try to like go through all the different workflows within medicine has
Yeah.
helped, I think, on the engineering side and the design side, figure
Yeah.
out exactly what features to build, how to build them, what should be built next. And
Okay.
so we've like with Scribeberry, it's not just an AI scribe, right? It's like a whole kind of end-to-end tool. It starts
Yeah.
with like pre engaging with the patient before the patient even comes in,
Yeah.
doing all the documentation during the visit, and
Yeah.
then even doing additional documentation and follow-ups after the patient is gone. So like it covers like all the different workflows.
Amazing, amazing. I mean, I think it's really cool what you guys are doing. But during the troubleshooting brainstorming process prior to launch, and just how was that process for you guys doing market research around COVID as well? I feel like I've had a few CEOs that mentioned that they launched their products around that time, or they were doing some market research. I guess that was challenging, right? The fact that you can't really reach out to physicians to get their feedback, whether they'll pay for the product, the right market fit, should we focus on one specialty, and so on. So I'm just trying to understand your mindset, the difficulties that you guys had at that time, prior to launching.
Yeah, I think for us, like it was all very organic. Like we didn't, set out to build like a business or a product necessarily. It was more like, I
Okay.
know this will work. Let's try it and see what happens. And so that's kind of what we did. And so it was very organic, word of mouth kind of growth. So to be honest, like we didn't do a lot of like proper market research. Aman and I, are friends primarily like first, and so it was very organic. Let's
Yeah.
build this. We don't really work like a typical company, I guess. We
Yeah.
bug each other at 4 a.m. and stay up. So it's been pretty natural, and I don't know if that's good or bad. It's probably not
Yeah.
typical, but
Yeah.
it worked. Yeah.
Yeah. No, I mean it's amazing because some of the best companies or products that I've seen out there, it's really because it's a problem that you're trying to solve for yourself, or in a man's case, your wife as well, right? And the people you were surrounded with health professionals, so you saw the need and you said, "Hey, there's an issue here. Let me try to solve it for the people around me or for myself." And then it became what it is today, right? So I think that's always a very refreshing approach to building a business or building a product, because the passion is different, right?
Yeah, we
Um,
were also like really fortunate, I think, and in terms of our timing and lucky in a sense, just because we kind of started with the proliferation of AI kind of starting out. Like GPT released like I think 3.5 just around the same time that we released. And
yeah,
so it kind of propelled all of it, and it kind of set certain levels of expectation in healthcare,
yeah,
which I think like certain levels of expectation within AI within healthcare. So I
yeah.
think that helped as well. So
Yeah.
it's been good. It's been fun.
Oh, okay. I mean, before we even dive in too much into the features and the product itself, for physicians or clinicians, health professionals who do not understand the technology, and what AI Scribe is about. And let's be fair, if you reside on LinkedIn a lot, then you see a post about AI every 2 seconds.
Yeah.
And sadly enough, I'm one of those people who post and write newsletters about it. I mean, I'm always excited to share and just bring value or information to my community that I'm trying to create on LinkedIn, which is predominantly physicians and nurse practitioners and so on. So for the clinicians who have no idea what Scribeberry is, would you be able to explain and just tell us what the product does?
Yeah, for sure. So Scribeberry essentially uses AI to reduce your clerical administrative burden, and that's in many different ways. One, the AI scribe component, which
Yeah,
will take your conversations and turn it into notes for you.
yeah,
You can dictate, you can use macros, you can fill out forms,
yeah.
you can do referral letters, you can pretty much automate much of your clinic's workday or your workflow,
Yeah.
depending on what that is.
Yeah.
Yeah, and save 1 to 2 hours a day.
Okay. Amazing. Did you guys take a look at template generators? Because when I work with physicians prior to AI solutions when it comes to note taking, a lot of physicians would use tools such as TextBlaze
Yeah.
or Delato or Phrase Express. There's a long list, and these tools still help the physicians and the ones who are it's ingrained in their habits now, and they can't shift to to AI Scribe. Did you guys take a look at some of these solutions to see how you can incorporate? I know you just mentioned macros, and that's part of the concept of some of these template generators. But did you look at these template generators to say, hey, I'd like to do this, but at a different level, and I'd like to incorporate some of the features into what I'm building?
Yeah, so the no-code version that I had initially, before AI
Yeah,
and before the scribing component was based around that, right? Like preset phrases and yeah, templates essentially. So
okay.
it was definitely like inspiration, I guess you could say, to kind of have that as an idea.
Yeah,
And there's so many products out there for that.
yeah,
But yeah, then it's kind of taking that and expanding it and adding extra functionality.
okay,
So you can do that. For example, like the macros, those are essentially templates. You can do that within Scribeberry,
okay,
but on top of that, you have all of these other AI features as well.
okay. So if sorry, go ahead, Aman.
No, I was just gonna say the cool thing about kind of what we've done with some of these features is like it's been like an interesting exercise for us on the design side to
Yeah,
understand kind of what everyone's workflow is and
yeah,
then try to augment their workflow with the AI. So for example, like Zaire talked about the macros, and like people are familiar with like things like you mentioned, like the Blaze
yeah,
and like Dragon dictation.
yeah.
But now we're introducing AI into it. So now like how do you like make that entire process more seamless and faster so that the doctor doesn't have to think about it necessarily. So that's what we've tried to do. So we've tried to incorporate like the dictation part with the macros part so you can automate like entire like notes with just macros if you
So,
really wanted to.
like as a
Right.
practical example, just let's say you have a patient conversation, and at the end you just say like macro A, macro B, and press generate. It'll
Yeah,
put your macros in the right place in your note,
yeah,
along with the whole visit. So you don't have to actually click and put it where you want. You can just say it.
right.
Yeah,
Yeah.
not only that, but it'll also fill out your forms for you using those macros. So like it's like everything.
That's exciting stuff because Form's not a lot of AI tools out there doing it. AI Scribe, and their approach is not as robust as what I've seen you guys doing. And just for the record, I'm not sponsored by Scribeberry. I've had physicians use your product, and I have done my comparative analysis on your product as well. And so I think it's a great tool. And like I said, my main goal here is really just to bring your platform to the light so that physicians know that it exists and they can make their own informed decision as to whether they want to use it. So what would you say in terms of talking about incorporating macros with voice recognition? What would you say to a physician who is still using templates religiously, using like a text blaze so religiously that they do not want to shift? Because I do have a few in mind who would say, listen, I'm a pediatrician and I have 40 to 50 different templates for my different 1 month, 2 month, 3 month checkups and so on and so forth. what would you tell a physician that knowing that they already have that mindset to using a template generator? How would you transition them into Scribeberry?
Yeah. Well, first thing I would say is, well done. Like at least like you've optimized your practice. And honestly, like I take a realistic look at it. If their workflow is great and they're doing well and saving time and happy, then stick to it. Like
Yep.
you don't have to switch. Um, and obviously, if you want to try it out,
Yeah.
more than welcome to, and I'll kind of show them the solution and the value.
Yep.
But everyone works a bit different. We've
Yeah.
encountered docs who still paper chart and
Yeah.
write by hand,
Yeah.
and they swear to never use an EMR.
Yeah.
And I've, yeah, through residency, so many different styles of clinicians. So I don't think you can really like force or like, put the product onto anyone. But ultimately, like, we just want to show value, right? So I would sit them down and say, hey, here's how our tool works. You decide, does it work for you or not, and leave it at that. I'm not very pushy, and I'm not kind of a salesperson, so
Yeah.
I wouldn't like, yeah, I
Yeah.
wouldn't push more than that. But yeah,
Yeah.
I mean, people have been seeing the value. I think
Yeah.
that's important. Yeah.
I think there's something also for everyone too. Like you don't necessarily have to use all the features.
Yeah.
Obviously you can, but then like you mentioned templates, like you can just use templates to create notes.
Yeah.
You can just use the form filling. You can just use dictation. So
Yeah.
like we've tried to make it approachable just in terms of like any workflow, and
Yeah.
it's kind of just your foray into getting used to AI within your practice. That's kind of the starting point.
Yeah. So because you mentioned templates, and I'm thinking, that's a big need. Whenever I speak with physicians, you would have the typical physician who would say, you know what, I just want to use. I don't need templates. The soap note is fine. It's good enough for me. Then you have those physicians who say, I cannot work without templates. I need, maybe I see, I'm a neurologist and I see stroke patients, EMGs, migraine, and so on, MS patients. I need very specific templates. Is that physician able to use Scribeberry to create this templates?
Yes, yeah, yeah, definitely. So we have a pretty kind of smooth template creation process. You just upload one of your notes as an example.
Yeah.
And Scribeberry will be able to kind of take that and
Yeah.
extract all the headings and the fields and the instructions and how to build that note. And then the user can manually kind of refine it if they want.
Yeah.
But then you can reuse that template with any patient and it'll create the note in that style.
Yeah.
We're constantly improving that process too, but for example, like we have some psychiatrists who do IMEs. We've had geriatricians, give us feedback on that they like that. We even had some people outside of healthcare, like we had some lawyers who have been using it for like specific interviews.
Yeah.
And so yeah, that template creation I think is definitely a feature of Scribeberry, area I think we excel.
Okay, because hallucination is a big issue with AI, as we all know. You guys are really the experts here. And one thing that I noticed is that with one way to reduce that is one, just adding a context of the visit, and two is using templates. And some of the feedback that I've received from physicians is that maybe when Scribeberry was launched, they noticed that your product has improved in terms of hallucination. So there's way less hallucination, and by hallucination, I mean the AI tool is maybe generating a little bit of context that wasn't discussed in the conversation. But like I said, a lot of physicians have told me that process has improved and has been. You guys are constantly eliminating that. So is there something you can share more about how you go about, eliminating hallucination, or if a physician was to ask you, does your product hallucinate a lot, and what are you guys doing about that? What would you say, and what would be the best way to avoid that as a physician?
So yeah, definitely. I think first off, AI hallucinates. Like that's normal. That's common. I think as the tech improves, it will get better. But like you said, there's strategies around how to mitigate that. Most basically, it's kind of the prompting and the templating.
Yeah.
So I think that's number one. Something that we've tried to improve there. Number two, it's kind of how you augment the model and the strategies you use in the back end. So
Yeah.
we've put a lot of work there, and we actually have kind of an algorithm that we use that reduces hallucinations. And so that's something proprietary that we've built out, and
Okay.
it just involves like
Fine
um,
tuning and stuff.
yeah, fine tuning and kind of this chain of thought to
Yeah.
get rid of that. So it's definitely an area we want to improve on even further.
Yeah.
We can never fully eliminate it,
Yeah.
but we try our best to reduce it. And then on the user side, I think like for us, we just try and be available. Like if they notice anything, let us know. We have 24/7 help. So oftentimes people will say, "Hey, my template's doing this and it's hallucinating."
Yeah.
So we try and work with them too. But I think with time it will improve. But
Yeah.
tech-wise, we still try our best to kind of
The
reduce
the
that.
other thing that we did recently is we've added the feature called memories, and so memories is a way for physicians to set their own like preferences, and so that also kind of enhances the context of the AI and also reduces that level of hallucination, but then also improves the preference. Like so, it depends on what they want in their notes, and it'll create it accordingly. So that's been some of the other like kind of feature based things we've done.
I remember working with a physician who I was implementing Scribeberry. I went through a process with the physicians just to let you guys know. What I normally do is, as a consultant, is that I meet with the physician the first time, understand the workflow, the different clinics that they work, what problem that they're really trying to solve. Because maybe, like we said before, maybe just a template generator would be the solution. It doesn't have to be AI, right? You don't want to shove something down the throat just because you're trying to make a sale. You really want to help them. So that's the approach that I use. So I have them we go through three different AI tools that work best with their workflow, and they test it out, and then they pick one. So it could be within a span of a month and so on. And one of the physicians had picked Scribeberry, and we had some issues with not issues. They were trying to tweak the templates, and so we reached out to your support, and it was really fast, right? They answered right away, and I was like, "Oh, this is great because you don't keep the physicians waiting." The good thing is that I was helping them create that template, so the physician didn't have to stop what they were doing and so on. I could just help them troubleshoot or improve the template. So support, that's a very important aspect to all of this. So how is your support 24/7? Because it felt like it was.
Yeah. No, I like we make sure that's a priority. And we make sure support is properly like knowledgeable and trained. And yeah, I think that's definitely important, especially knowing that as a doctor, like it's very
Yeah,
annoying if let's say you're stuck in the middle of your clinic and there's no one there to help.
yeah,
We've all experienced that, in the past with let's say EMRs or other tools, and
yeah.
yeah, you don't wanna derail a whole day. Like
Right.
that's awful. So we
Yeah,
try our best.
yeah.
Obviously tech issues do come up, and but that's why we want to make sure we're there kind of 24/7.
Right.
Yeah.
Okay.
The other thing is our support is also a human, so it's not
It's not
AI.
AI.
It's not AI.
Yeah, so
Not a
I
bot.
think that's important for the clinicians.
Yeah. Yeah, no, absolutely. I mean, I use a lot of AI tools. I use a scribe myself, but not medical because I'm not a medical professional. One of those tools where it listens in on your conversation and so on. So I find something like Scribeberry for medical professionals very practical. But yeah, no, it's like I said, the support was great, and we were working on templates as well as forms, and so we were able to import a form into Scribeberry and have specific sections that we wanted to preview. So are you able to just, talk about where your forms features was at maybe a few months or last year, and where you guys are at right now in terms of forms? So if a physician was asking how advanced or how flexible is your forms feature, can I upload a form, a medium to a complex form like a SAQ form into your platform, and can I use Scribeberry for that to fill a form?
Correct. Yeah. So you can upload any form. Like in Alberta, we have the AISH form, which is often very long. A common one, I guess, across Canada is like the CRA, Disability Tax Credit, CPP. So those forms often take a lot of times. VA forms, special auth
Yeah.
forms, but you upload them. Um, when you upload them initially, so from a tech perspective, we notice like sometimes that the tagging wasn't perfect and in the automated system, so we do actually manually review forms. It takes about like 24 hours, and then
Yeah.
once we test it, make sure it's working okay, then we publish it, allow clinicians to use it. The
Yeah.
hope is eventually to automate that even further.
Yeah.
But once a form is ready, then yeah, you can use it over and over, and it will fill out in all the right places, essentially.
Yeah, and it typically doesn't matter like how complicated the form is. Like you
Yeah.
can have like multiple fields, and it's usually like fine.
Okay, amazing. Yeah, no, I think it's forms is it's really a big question that I usually get forms and templates. How am I able to use forms? And in the past few, I think 6 months, it's been no. The answer has been no because the AI tools out there weren't really doing it as much as Scribeberry is right now. And because most physicians are using EMRs now, right?
Yeah.
And which really leads me to my next question, which would be, are you guys worried about the EMRs because they could easily build something like this in-house, or maybe just create APIs to link with tools like yours? But are you worried about EMRs being a competition, or are you looking more into creating partnerships with them where they can help their physicians with being more efficient with a tool like Scribeberry?
Yeah, for sure. So I think there's two aspects to that. One is there's value in the integrations, and so we are working on different integrations, partnerships with some of the bigger vendors in Canada and the EMRs.
Yeah.
I think for us, like EMRs, they can in-house and develop their own, and they might, and some have. But I think users will still find value in Scribeberry because that's effectively our entire product. And so we put a lot of focus in terms of how do we make it the best tool possible. What we've seen so far anyways is when EMR integrates like an AI scribe, there's a lot of like missing pieces or optimizations that don't exist. So I think, there is a market in and of itself for an AI scribe tool that's independent, and there's a lot of benefit to that too. Like we'll have doctors who use Scribeberry in different settings. Like they work in a hospital, they work, in a clinic, and so they have one scribe that they use. As opposed to if it's in the EMR and they use different EMRs, sometimes there's another learning curve. There's different features.
Yeah.
So that's the other side of it. So I think it's kind of pros and cons. Obviously, integration is important, and so we will be integrating with a lot of vendors.
Okay.
But there's also value in the standalone, and so yeah,
Absolutely.
I think it's very similar to like when EMRs first launched.
Yeah.
Um, there's still multiple different players in the EMR industry, and people will choose what they like, and
Yeah.
I think that's kind of the what will happen. But
Yeah.
I could be wrong. But yeah, I think that's the way it might go. Yeah.
So far, we've also seen like some of the bigger players in the EMR market. They typically have like a marketplace
Yeah.
where they like open up their API and you can take advantage of it. And so that's what we've been doing with some of the big players. And I think it also helps the EMR company to have that, just because they have their core set of features, which
Yeah.
is like actual AMR, the data,
Yes.
the housing. Like I think that makes more sense to focus on that.
Yeah.
And then it also becomes like your source of truth for the patient record, right?
Yeah.
And then the Scribeberry or anything else can become like an augmenter of that data layer. And so
Yeah.
that's how we've seen it in some of the bigger players.
Yeah.
And I think they've been successful that way.
Yeah. Do you have any, or are you able to share any EMR that you have integrated with, or it's something that you're still figuring out your partnerships and so on?
So we have a few, but until it's launched, like
Okay.
I don't want to
of
don't want to
course.
say much because
Yeah,
there's NDAs and different things involved.
yeah.
But big EMRs in Canada, essentially.
Okay,
The majority of the ones that people use.
okay.
And then the ones I guess we could mention are more like Epic and Cerner,
Oh,
um,
okay,
because they kind of have like, easy API access and things are available a bit easier. So we are, doing that as
okay.
well for more hospital-based stuff. But yeah, we're focused, I would say, more on Canadian EMRs.
Yeah.
Uh, and so those will hopefully launch soon this year, hopefully in
Okay.
the first half of the year.
Yeah, that's amazing. I mean, because to be honest, I think that it's not a tedious process for the physicians to copy paste their notes right from the AI tool to their EMR. But ideally, it would be great if it's synchronized, right? So they don't have to leave their EMR environment. But so that would be something interesting for health professionals when once you guys get there. But at the same time, I haven't seen it to be a roadblock. No one has told me yet that I'm not going to use an AI tool because it's not integrated with an EMR. As soon as they understand the concept of the technology, then they're eager to try it out because note taking is a struggle. And so some of them ask me, I work at a clinic where we use mostly desktop computers. I don't really have a laptop, so if I want to use Scribeberry in my office, how do I go about that in terms of just capturing the sound or the audio? Do I need to buy an extra mic or a podcast microphone with a good range and so on? What's your advice to physicians on that?
Yeah, so like we've actually worked on this workflow and we've thought about different workflows, and so we allow kind of the mobile experience, we allow recording of audio. So we have like a number of different physicians who are working in the hospital in the ER department, for example. They have their phones with them, and so you can use Scribeberry on your phone to do the recording, or you could just record like audio separately on like a dictaphone or even like the voice recorder app, and then upload that file later to Scribeberry. So we try to cover all of the different workflows.
Yeah.
So you can do something on your phone, jump back to the workstation computer, log into the web app on Scribeberry, and because everything is synchronized, all your notes will show up in the same spot. You can transfer it over to the EMR pretty quickly. So yeah, like we've tried to cover the different kind of ways people use Scribeberry.
Yeah.
You could walk around, you could have like home visits, do recordings if there's no internet connectivity,
Yeah.
come back to Scribeberry later on, upload those files. So
Yeah.
yeah, I think we tried to cover the majority of them, and I think that's where we started, and it's been good.
In terms of specific requirements, not really. Like you just need a mic that works.
Okay.
Um, yeah, and I mean that's phone, that's computer, that's whatever tool
Yeah.
or device works.
Right. The phone is, it seems to be the most practical because I've worked with physicians who would work at the urgent care where they see patients in three different exam rooms and then they have the back office where they do the charting. And in the different exam rooms prior to AI, they would, have a cheat sheet where they take a few notes and then they go to their back office and develop those notes. But now with a tool like Scribeberry, they can have Scribeberry open on the computer in the back office and just have it open on their phone. And then they just record each conversation in each room and then go back to the office on their computer and just develop.
It's interesting too, like the ER. So that was an area we got feedback because if you think of an ER workflow, like
Yeah.
doctors don't finish a visit, right? They go see one patient and then work them up. While they're working up that patient, they go see another patient. They see a third. Maybe they're called away to like a resuscitation, and then they come back. So one of the cool things with Scribeberry is you can create multiple drafts. So let's say you have 10 or 12 visits on the go.
Yeah.
You can do all of those and just tab or switch between them.
Yeah.
And then at the end you can sit down and you have all your transcripts there.
Yeah.
You can add or modify or do whatever and just generate, and all your notes are done. So it's been popular in kind of the ER for that specific reason.
Okay.
And just being able to save drafts and not have to do one visit and then another and then another. right after each other. So
Okay. So, if a physician was to ask, what's the biggest value proposition that, Scribeberry brings to the market
yeah.
as opposed to its competitors, right? So, why should I use Scribeberry as opposed to using other tools out there? Well, what would you say to that? Because sometimes they ask me those questions and I have my answers because I've done my comparative analysis. And so I'm just looking at it from a consultant perspective. But as, the guys behind the scenes who are creating this product, what do you say to a question like that to a
Yeah.
physician?
So the simple way to answer it, I think, is like we're the most feature-rich platform at the lowest price point. And yeah, so that's kind of in a nutshell.
Yeah,
But I could expand on that and go
yeah,
into that. But we cover like the pre-visit, the visit, the post-visit,
yeah,
the referrals, the notes, the templates, the macros, the memories, the entire workflow. We're adding a lot to it. We're building out integrations.
yeah,
We don't tier our pricing, or make things complicated. Everything's really simple. Our onboarding is easy. Our support we try to make simple as well.
yeah.
Um, so yeah, no, like path of least resistance workflow for the clinician, good onboarding, lots of features,
Yeah.
and low price. So
Right.
that's kind of it.
Yeah, no, it's that's great. I think that really does sum it up because I've seen the product and yeah, I see you have a lot of features compared to your competitors. They offer different things and it works for some physicians and it doesn't for others. But yeah, I see the features and I think it's great what you guys are doing. But you mentioned onboarding and I'm thinking consent, right? Because if a physician wants to use, because I'm assuming that a physician can use or a health professional can use your tool to record the conversation with the patient or without the patient, which is in some form of a dictation, right? And the former, where the patient is in front of them, they need to get explicit consent. Now, I say explicit consent, even though that's from my perspective, because in Quebec, the CMQ or the Collège de Médecins advises physicians that your best practice here is that if the AI tool is not using the conversation with the patient to train the models, then you can just get a verbal consent and that's it. But if they do train the AI models using the conversation, then yeah, you definitely need the patient to sign. So I have two questions there. One, do you use the patient conversation interaction with the physician to train the model? And two, how do you handle the consent workflow?
Yeah. So first question, we don't train on any input data at all.
Okay.
All our privacy information we actually make public as well, so clinicians can look through it
Yeah.
on our website. That includes like our PIA, our SRA, our compliance dashboard, which like monitors our system in real time.
Yeah.
So that's the first part. The second part of the question, so the consent. We have a sample kind of informed consent form. Again, that's publicly available on our website. But clinicians are a bit different in how they want to do that. Like
Yeah.
we've had some docs say, like, I want every patient to sign this.
Yeah.
Some docs get verbal consent and note that in the chart. Some take our sample consent and change it a little bit. Some get the front office, to reach out to patients and talk to them about it. So workflow is really dependent on the clinician. But consent obviously is important. Like you need consent.
Yeah.
And a good article for that is the CMPA. They actually put out, an article on consent for AI scribes.
Yeah.
And I think, yeah, that's kind of a good reference.
Right, because with the still on the consent topic there, you still have the front desk, and I talk about this with the different suppliers of AI scribes out there. You kind of shift some of the tasks from the physician to the front desk, meaning that the secretaries or the receptionists have to get the consent from the patient. And that's if they don't have an EMR that can send a pre-visit questionnaire or consent for the patients to sign beforehand. Um, is this something, this workflow in terms of sending the consent to patients beforehand, is that something that Scribeberry is looking at implementing, maybe just to help the administrative staff when it comes to that workflow?
It's a good idea. Honestly, like we haven't got a lot of feedback on that.
Okay.
But yeah, I think it sounds interesting. Like
Yeah,
you know,
it it, it could tie nicely in with Ada. So Ada is our autonomous
Yes.
doctor assistant, and so basically it does like a pre-consult with a patient before
Yes.
the physician sees them, and so part of that pre-consult can include the consent as well, which wouldn't be too difficult to do.
Yeah.
Yeah.
and with that, we're building it out a little bit, so it might be something that we could incorporate, anyways. Yeah.
Right. So Ada, that you said that's like a nurse assistant or physician assistant. What is it exactly? Because I tested the tool, and just for physicians who or clinicians who don't really understand how that works, is that something that you can send to the patient before the visit for them to complete and so on? So what's the patient experience in that?
Yeah.
How much do the patient needs to participate in that process? If you can just quickly walk me through it.
So Ada is kind of like voice activated AI forms, is how I would say it.
Wow.
Um, So let's say, you as a clinician, you need to take a bit of a history. You just launch Ada, you send your patient a link, or if they're in like a exam room waiting for you, you get them to scan a QR code, and then our AI, like Scribeberry will, or Ada in this case, will take that patient complaint and then interview them for you. And so when you enter the room or that patient comes in later, you have the whole history there waiting for you. So that's Ada in a nutshell. And the patient can interact with Ada, and it's adaptive. So if the patient, tries to trick it or goes off track, it'll kind of adapt to the conversation and ask those questions as needed. So it's kind of like the smart form that's done in voice format.
Okay.
Um, Patients so far from feedback, like, they tend to like it. Like no one's really complained about it. For clinicians, we've heard a lot. One, can the patient do it silently, like type instead of talk? So we're looking at that. Different languages, can we input our own questionnaires? Can we schedule times that these can happen at? Can we tie it to a phone number? Can we have patients call in instead of us calling out? So
Interesting.
can we do the front office, right? And then book
Yeah.
and rebook patients and schedule them.
Oh.
Um,
Yeah.
so we're almost ready to kind of launch a version 2 of Ada, which would
Okay.
include all of these features.
Yeah.
But yeah, it's a pretty cool thing, and I think we're both excited to see like how usage with that goes.
That's amazing. That's amazing. I mean, I played around with it and I was just like, wow. And I looked at it like I think early last year, if I'm not mistaken. So it's been a while that you've had this. You had it in
Yeah.
beta mode at the time that I tried it out, and I was just like, wow. You guys, Scribeberry already has something like this, while other platforms and are still focusing on just um, they don't even have the templates or forms and so on. So it was nice to see that, which really speaks to what you said before, that you have a whole bucket of features that you're giving away to physicians just to enhance their experience. I think that's amazing. Do you see Ada complementing? I try not to use the word replace, but complementing what the nurses do, because the nurse triages the patients, right? And
Yeah.
the nurses would ask 10 or 5 questions, and the patient. So the nurses spend 5-10 minutes with the patient triaging them, a set of questions, right? Is that something that you can incorporate with Ada to do that part of the job, but maybe the nurse can focus on, I don't know, something else?
Yeah, for sure. Um, I at first, like, I don't think we're trying to replace anyone. It's more like, if in clinics, big bottlenecks, right? Like you have one nurse who's trying to do the job of maybe like 3 or 4. So it's a tool that can help the nurse, like, okay, let's interview these patients, and then let's send Ada to like maybe these patients who are less complex, or that I know a bit better, and so it saves them time. Maybe they can use that time for something else. front office, in a rural practice, you have, let's say, like, I don't know, tens of thousands of patients,
Yeah.
and you have two receptionists trying to handle, like, a ton of phone calls. Patients get mad. I've had patients come into, like, the clinic
Yeah.
during an appointment, and, like, they've complained. They've said, it's so hard to get this appointment, not because, like, you weren't available, but because every time I call the front desk, nobody answers. And it's just because the clinic
Yeah.
is understaffed, and there's no solution because you're in a small, town.
Yeah.
So imagine, if you had an AI that could do a lot of the receptionist or front office's work, it would save their time and allow them to maybe, feel less stressed or burned out. So
Yeah,
that's the value add, I think. Yeah.
it doesn't just augment the patient experience and the physician experience. It augments the nursing experience, right? Because then they're less burnt out. They're less inundated by angry patients calling them. Like, they have a little bit more time to, like, focus on what they want to focus on. So I think it's a win-win situation here.
Amazing. Yeah, I think that's also a game changer. For clinics and physicians who are open to this. And have you deployed Scribeberry clinic wide? Because I know that individual physicians can sign up to your tool. And I ask this question because the different use cases that I see. One of the questions that I ask the physicians before we implement any AI tool is, why do you need to use, what problem are you trying to solve? Do you want to be able to see more patients or leave on time or feel less stress thinking about the notes during your patient visits? So the ROI is really always felt by the physicians, right? It only gets trickled down to the clinic financially if the physician tends to see more patients because the AI tools save them some time. So I'm just curious if you've had to deploy Scribeberry on a clinic wide basis.
Yeah. We have, like, honestly, our go-to-market strategy has been to target, like, smaller clinics, and I think that's because we're us too, bootstrapped. We understand the workflows, and we haven't really targeted larger hospitals, but we have actually deals with clinics, with OHTs, like in Ontario, with PCNs in Alberta.
Yeah.
And I think, yeah, like you said, every clinician is a bit different in what they want.
Yeah.
What I will say is, like, when we run our surveys, about a third of doctors using Scribeberry say they want to use it to allow themselves to see extra patients. And so, like, we took that info into a meeting, with kind of policymakers too, and that's a pretty interesting statistic.
Yes, absolutely.
If you're a clinic, like, looking to implement something,
Yeah.
that will earn you extra revenue. If you're government looking at policy to, let's say, reduce wait times, if some doctors are willing to take on 30%,
Yeah.
or 30% of them are willing to take on more of a workload, that's phenomenal as well.
Yeah.
So
Okay.
yeah.
Yeah, because you have what I've noticed is that physicians who are easily convinced or they see the benefit right away without having to try the product are physicians who run their own clinic. They own their own clinic, so they have the entrepreneur mindset as well, and they are looking to be as efficient as possible because they're wearing multiple hats, right? As opposed to one where they work at a clinic and they just pay for overhead and so on. They pay an administrative fee. Is that what you're seeing on your end as well? That most of the clinics that tend to use this are, maybe private clinics that are run by physicians that, they just want to save more time. I'm just curious on that.
Not really. Like, I think
Oh,
we've seen
okay.
both, actually. We've seen like clinics, like the owners who have been interested,
Yeah.
and then we've seen docs who aren't entrepreneurial, like they're more, in purely clinical medicine, and
Okay.
like you said, in the overhead.
Yeah.
In fact, I would say they see a lot more value because for them, there's also a lot of intangible benefits. Like, I can look at my patient, I can, not have to chart after hours. I can go home on time.
Yeah.
Um, So those like benefits, like for us, it's always like, there's two things: there's time and there's money,
Yeah.
and I think time is definitely more valuable to a lot of physicians than the
Yeah.
actual income part.
Yeah.
Um,
Okay.
so I think that's the big selling point is more saving time.
Right. Yeah. And another key feature that I noticed with Scribeberry is the language feature, right? Um, I've had physicians who have asked me for Persian. I need a tool that can speak. So I can, because 50% of my patients are Persian, or Dutch, or Hindu, or all these different languages that not every single AI tool has it. So is that something that Scribeberry has? One, and two, can you use Scribeberry as because in Quebec, it's English and French, right? Majority of physicians, that's the bulk of their practice. And during a conversation, a patient can, we can switch back and forth with the language, English and French, and so on. And that's something that most, physicians think about when they're looking for a tool. Is that something that your Scribeberry can do when it comes to auto detecting the language that the physician and the patient speaks?
Yeah, yeah, definitely. So that's something that we thought of as well. So we have the auto detect feature where it'll switch languages based on kind of what's being detected.
Okay.
Primarily used in like Ottawa and Quebec and kind of Ontario, Quebec area. But you can choose any languages. So it could be any two or three languages. It'll auto detect and change. And then along with that, we also have a translation feature. So let's say like if the doc is more fluent in English than French or whatever language, you can set a from and to language and read the translation in real time. So that's been helpful too as well. But yeah, we've tried to kind of cover all languages that we can. For example, like we had a large request for Punjabi,
Yes.
with patients in BC.
Yeah.
So we added that. Yeah, Farsi has been a request. There's
Yeah.
Mandarin. So yeah, we try to kind of cover as many languages as we can.
Yeah.
It's also a workflow thing, right? Like, so if in the hospital, oftentimes there's a translator that comes, like a physical
Yes.
kind of device, or like a person even sometimes. And so this kind of like inundates that entire step in that process, and so the
Yeah.
physician can right away see the translation
Yeah.
of a patient that they may or may not understand.
Yeah. So you mentioned translator, and I'm thinking, sometimes I would take my mom to her visit, and if say for example, my sister and we take our mom to go see a physician. She can speak English, but we're all there having that conversation sometimes on behalf of her, and she's answering the questions herself. Is that a context that your Scribeberry can capture? Because I've had some physicians ask me, and which is normal, families go in there with their loved ones to either translate or just provide more information. And some physicians will ask me that, I maybe 40% of my patients are older, elderly patients, and would they always come with someone. And so, if I use a tool like Scribeberry, would it be able to differentiate?
Yeah, so there's two things with that. Like one, yes, you can use it for the translation,
Yeah,
and that's very useful. The second thing too, like let's say you have an elderly patient who speaks a different language. After you're done the visit with Scribeberry, what you can do is actually create like a summary and handouts and next steps and whatever you want for that patient in their own language. So let's say they speak Punjabi, you can create like a handout for them of what was discussed in Punjabi. Um, and so that there's a lot of value there too, because now, that communication barrier, like them understanding, remembering, and then actually like taking action on their health, like that's often a huge, a huge area where patients will kind of fall off. Oh, I thought you said this, or I didn't understand this, or I remember you said like take this medicine, but I wasn't sure how much. So we can kind of bridge that gap as well in the
yeah,
communication.
yeah.
Yeah.
Um, because so you're talking about communication and having a family member in the room. I mean, if we really move towards security, we talked about the fact that Scribeberry doesn't use the patient conversation to train its models. So when a physician comes to you and ask, in terms of privacy and security, yes, I understand that you have a privacy policy on your website, but I'm a physician. I don't have time to go and look at that. You know, I'm sure you can attest to that, Zaire. Well, you're you're the more advanced physician here, so you would spend time looking at that. But for the physicians that won't look at, the privacy policies and so on, and they just want to understand, all right, your data centers in Canada, are you PIPEDA compliant, or HIPAA? I know HIPAA is more for the US, PIPEDA for Canada. How do you ease their mind when it comes to privacy and just security and compliance?
For sure. So the first thing is like I'll describe like the data journey, and just simplistically how it works is when you press record, we're not actually storing the audio. We take the transcript. So the audio gets transcribed every second, and we delete that audio right away. That transcript gets collected and it's encrypted, so we can't see that. Only the physician can. That data then gets sent securely, again encrypted, to our backend servers, hits our AI model, and then gets streamed back to the physician's account, in their notes. The only reason we do that server side and not like on the user's device is so that we can synchronize notes.
Yeah.
So let's say if you like an EMR, if you go home, you can access your EMR there or in the office. So that's the reason we do that. But once that note is there, it's in full control of the clinician. Through that entire process, we never see the data. We don't retain it. We don't train the AI model on it. And then when the clinician deletes it, it's gone forever. So that's kind of the general overview of data. So I usually will tell physicians that. And then the specifics and kind of more details, we not only post our privacy policy, but we literally post everything on our privacy page. So we have a real-time compliance monitoring dashboard. I don't know if you're familiar with like Drata or Vanta or these third-party privacy solutions. So they actually we use Delve, and they plug into kind of our systems in the back end and just monitor everything. Are you following security best practices? And if not, we're alerted and we have to fix it right away.
In fact, such to the point where if you push any code to our code database, it'll automatically synchronize it in real time and not allow for it to publish if it wasn't. So okay. It's very, very stringent.
Yeah, and then along with that too, this is all public, but we have our security and kind of risk assessment, our audit essentially.
Yeah.
That was done by a third party. So we make that public. Our PIA is public. All our signed contracts, if they're not bound by NDAs, we make them public too.
Okay.
And and we're open. If any physician has any questions or they want to access other documents, we're more than happy to share them too.
Right.
And all our servers are in Canada. The exception is for US users who we do have additional US servers, but if you're in Canada and you use Scribeberry, everything stays within Canada.
Amazing. Yeah, because I have physicians who, they're skeptical. They think it's a great technology, but they don't want to be the early adopters, they look at, or they're waiting for their associations to provide them some guidance as to, how to go about selecting a tool. And, so like I mentioned before, the Collège de Médecins has provided them with some. That was last year. I try to keep up to date, even the CMA and so on. But what would you advise a physician who is trying to find a product, an AI scribe for their practice? What should they be looking at, and what should they be asking the vendors? So just in simple terms, so that they know that they're doing the right due diligence, and not forgetting the fact that I'm here to provide the physicians with much information as a consultant. But if a physician was to speak with you directly to say, I'm not even sure if I'm going to use Scribeberry or whatever platform there is out there. Can you just give me some advice what I should be looking for when it comes to tools like this? Because there's 100 of them out there. Yeah.
Yeah. I think first evaluate the workflow, right? Does it work or not?
Yeah.
And go through that in detail, like how would it fit with your practice? From a privacy side, I would ask, where's the data stored? Is any retained, and is it used for training? So those are probably three high points to hit.
Yeah.
And then beyond that, what is your trial period like, your pricing, and kind of, the cost of
Yeah.
it.
Okay.
Support, onboarding, and then test it out. I think most scribe tools offer free trials, and most are pretty easy to get started. Usually just a click or two. So try it out, right, and kind of see. Yeah.
Okay. Okay. You mentioned you guys play soccer. If I can
Yeah,
digress a little bit.
yeah. We play a lot. Do you play soccer too?
Yeah, it's been a while. I'm not a little bit very rusty.
Yeah,
Yeah, but
yeah,
I used to play a lot. Much younger. I mean, I'm 33, so
yeah, yeah.
but I'm born and raised in Cameroon, so I grew up playing soccer
Nice.
quite a lot.
In Edmonton here, we have a mini World Cup, and that's every two
Oh,
years.
wow.
So it's like all the best players they play in for different countries, and like yeah, it's a lot of fun, and fans come out. So
Okay.
the last time I played in that, I played for Cameroon.
You played for Cameroon?
I played for Cameroon. So
That's amazing.
yeah.
Okay.
But same, I used to play a lot, but I'm old now. Like
Yeah.
I feel like my legs don't work like when I start running.
Yes.
They feel heavy, and
Yeah.
like even if I eat well, I exercise,
Yeah.
like
Yeah.
it's not the same. But I try to play as much as I can.
Right.
Yeah.
Yeah, there's these meetups, Amaan, as you can see, we digress a little
Yeah,
bit.
sorry about that. Sorry about
No,
that.
no problem. Because there's this app that I use from time to time, Just Play.
Yeah, yeah,
I'm sure you're familiar with it.
yeah. I've heard of it.
Yeah, yeah,
I
you
used
just
to play.
yeah.
It's for like pickup
Um,
games, right?
Pickup games, yeah. So you just find soccer in any neighborhood, and you just go join. You pay whatever, and that's it. Do you guys do you follow any competitions like Premier League or Bundesliga, any of that?
Yeah, yeah. I mean, when I was a kid, I used to watch religiously. Like wake
Yeah.
up at 5 o'clock and like watch every Premier League
Oh
game.
wow.
Um, but I'm a United fan.
Oh,
And so lately I haven't been. I
I
mean,
guess I should have asked
one
at the
like
beginning.
yeah, one like we're not doing too well. But I would if I could, but there's no time. Like
Yeah,
I'm usually sleeping or
yeah,
with the kids, or
yeah.
so it's hard to follow. But how about you? Do you watch?
Yeah, yeah. I watch. It's like you. These games are so early. I
Yeah.
mean, I wake up relatively, but I'm a Chelsea fan, right?
Nice. Same here. Same here.
Okay, all right, let's go.
Let's go.
Yeah, yeah. I mean, I have been watching just like you. You get busy and commitments and so on. You watch a highlight here and there, but yeah, no. What I've been getting more into is football. Like NFL and so on.
Nice, nice.
Just with my father-in-law because he's a huge fan. But when it comes
Yeah.
to soccer, it's something I grew up playing. My brother still play competitively back home.
Nice.
But yeah, it's just a way to keep in shape, right?
Yeah.
Yeah,
Do you
yeah.
play like any FIFA or video games
Oh
at all?
man, I had to slow down from that.
Yeah, me too.
Yeah, yeah,
During COVID, it was a big problem. I would just like
yeah.
I would play too much.
Yeah, same, same. And so most people who don't play FIFA, they don't understand, especially if because I'm guessing you play with your friends or you play online, right?
Online, yeah, yeah.
Yeah, exactly. But there's just it's you can't explain it. There's one thing playing FIFA, it's another thing playing Call of Duty and all of that. But to me, FIFA is a game that if I want to play a video game, that's what I play. You know,
Yes.
and I don't know, man, do you play?
Yeah, yeah, I do, but
Yeah.
I'm not as good as like Zaire is like very, very good.
No, I got too obsessed at one point. Like
Oh
I
wow.
started like I would like YouTube videos and like try and get really good, and
Oh man. Okay.
it was too obsessive. Like after a while, I had to quit.
Okay. Yeah, because I was gonna say let's connect once one time and
Yeah,
play,
yeah,
but I
we can
won't
play.
even go there.
Okay, let's do it. We should.
Yeah, yeah, no,
Um,
absolutely, absolutely. And you said you're Zaire, you're in Alberta, or
Correct. Yeah, yeah, in
oh, okay,
Edmonton.
and in Mountain, and Aman, you're in Toronto, right?
Yeah, yeah, I'm in Toronto. So I guess the Premier League games are a little bit earlier for me, so or a little bit later for me, so it's still like possible. But
Yeah,
with the kids, it's too hard to watch now.
Yeah.
and you both have you have kids. Well, you just said you did, but how many kids do you
Yeah,
have?
I
Zaire's more more
Yeah, I
than
have three
me.
kids. I have
Three. Wow. Okay.
yeah, 7-year-old, 5-year-old, and then a baby, like three
Wow.
months.
Wow. Congrats, man. Yeah.
Yeah.
Yeah, I
Amazing.
have two. I have two, one 4 year old and one 2 year old.
That's amazing.
Um,
How do you guys? So how do you? Yeah, maybe I might include this, but how do you manage running? Creating a tool like this for physicians, and at the same time you have a family,
Yeah.
and you have your other commitments, but you're trying to build. You're spending so much time understanding what the physicians really want, if what you're providing them is working, brainstorming, and so just running your company. How do you find that balance to be able to do both?
yeah, it's
Yeah, I
been
think
tough.
first, yeah, like no, like first I'd say the great wife,
Yeah.
I think that's important. So
Yeah,
credit to her.
yeah,
Um, yeah, and good family support. And then, like for us, I think running Scribeberry is fun, honestly. We don't really look at it as work, which is why I said, like we'll bug each other at 2 a.m. and 3 a.m. We'll work random hours of the day. It's a challenge, and it's something I think like that's a lot of fun.
yeah,
I don't know any other word to describe it. So
Yeah.
it doesn't feel like work, and when something doesn't feel like work, it's like easy to kind of fit it in.
yeah,
So I think, I don't know, Aman, if you have anything to add, but
No, I was just gonna say. I mean, in terms of the family side, I see it as like a driving force almost, like because
yeah,
yeah,
like
it's
these kids
motivating.
are getting older. They're like watching their parents, kind of like what they're doing and stuff.
yeah,
But then also like you also want to make sure that they're set up for the future, and you want to
yeah.
do something that makes other people feel good about themselves. So I mean, I see it as a driving force more than anything
Amazing.
else.
Wow. Yeah, no, I find that inspiring, because I don't have any kids of my own. I have a girlfriend and, getting more serious. But, and I started my entrepreneurship journey about 2, 3 years ago. And, I'm working on several projects and so on. But, running, doing what you guys do at the level that you do it, I think it's incredible. And I think a lot of people who so if someone was to ask you, um I'd like to get into the health tech space, from your experience and your journey, what would you advise them in terms of solving problems in healthcare, whether it's providing a service or building a product? What do you think you guys have learned that you think would be valuable for someone who is trying to do the same?
Yeah. I think first, you have to like identify a problem and solve it. And there's so many problems. I know you're aware of that too in
Yeah,
healthcare.
yeah,
So that's number one. Two, you just have to try, right, and be passionate about it. Seek out solutions. I think that's the biggest thing. I'm happy, Aman and I, if anyone has any cool ideas or things they want to implement, we're obviously like happy to help in any way we can. The other aspect, like in terms of the actual problems, I think a big problem, is like that data interoperability. If someone solves that problem, that would be great.
yeah,
um,
yeah,
it's so hard to find data. Let's say you see a patient in a different province, or you see a patient in clinic as opposed to hospital.
yeah,
You suddenly don't have access to records,
right,
and you have to go through full history. And for patients, it's so annoying too, right? Like,
yeah.
I just told the Emerge all my meds. Why do I have to tell you all my meds again? Um, so, yeah, that's maybe a big problem or an area, but yeah,
Yeah.
I think it's just finding a problem.
In terms of like launching a product, like what really helped us is launching earlier than we probably had to. Like we just created something that was very MVP, and we pushed it into Facebook groups and like different physician groups, just to get their ideas on kind of what they thought of it. and that really propelled not only our momentum but then the actual product itself. And so like people would constantly give us like great feedback, negative feedback, positive feedback, and say, oh, you should do this, you should do that, and that really helped kind of like drive the entire project forward. So I would definitely recommend like releasing earlier than you can.
Right, and fail fast, right?
Yeah, yeah.
Yeah.
Yeah, yeah. Because I know of in Estonia. I don't know if you guys are familiar with them. I think it's a population of about 1.3 million, and about last time I checked, so it's smaller than Montreal, right? So Montreal is about 1.7. Again, these numbers must have changed the last time I checked, but in Estonia they have their EMRs. The EMR that they have is really based on the technology is blockchain, right? And I think because you mentioned Zahir, you mentioned interoperability. I think
Yeah.
nationwide that solves that problem for them, right? And in terms of security, I can't sit here and pretend to understand blockchain to its full entirety, but is that an area that you guys have even thought about to kind of have some sort of AI and blockchain, or it is too early to
Yeah.
even be having those conversations?
We've seen other tools utilize that blockchain technology, but for us, it's like, okay, you can do that within our platform, but then what about beyond that, right? Like at the government level, at the provincial level, um, so you want to kind of have an architecture that's singular and that's unified, and I think that can only come from like a top-down approach. Do you know what I mean? Like somewhere, some policymaker has to decide, like, okay, we're gonna unify all of our data. Um, Companies have to oblige, and there's a lot of politics and lobbying and things involved in that that I don't want to get into, but I'm sure like there's different interests, right?
Yeah.
Because data is valuable, and so like different companies will have different policies and interests on how they want to maybe approach that.
Okay.
For us, like blockchain wise, we've thought about it, we've discussed it, but we haven't really implemented it because again, we come back to the workflow and the value add.
Yeah.
Within Scribeberry, sure, there might be some value, but greater data interoperability.
Yeah.
Um, yeah, I
I
think there
think it
has to
wouldn't
be
be
some.
our exactly.
Yeah,
I don't
it
think it
wouldn't be
would
our
be
area.
in our in our area of expertise. I think if the government implements that, that would be amazing.
Amazing, amazing. So, just talking about future, because that sounds like, to me, that sounds like a futuristic feature. But from your perspective, it's doable, but it's not. What's really the added value to your clients is to the physicians, right? Like, is it solving an extra problem, or for you you need to make it has to make sense for you for Scribeberry to incorporate that. But looking forward, so what can physicians or clinicians look forward to when it comes to just features this year for Scribeberry? Would it be more improvements on the templates or enhanced partnerships? What is it?
Yeah.
What should we all be expecting? With an exciting tool like yours.
Yeah. So first, I think like Ada, we're gonna build out Ada and launch that. Extensions and integrations. So different ways of using Scribeberry desktop, Chrome, and then integrations with EMRs, whether web-based or so like more software-based. Beyond that, lots of cool new AI tools that like I think other companies aren't doing. So we're looking at like automating the entire kind of EMR process for
Yeah.
clinicians.
Okay.
Like, so let's say you walk into a room and you talk, your EMR kind of turns into maybe Alexa or Google, and you can just say, hey, fill out this chart, or hey, do this for me, and it'll do it for you.
Okay.
So that's something we've been playing around with, but
Ama-
yeah, we have a lot of crazy ideas, but in
Yeah.
terms of implementation, I think first integrations, Ada, that's probably top of the list. Yeah.
Okay.
Yeah, the major trend I think is like the AI agents side of things, right? So just think
Yeah.
of an AI agent and then covering all the different workflows, not just for the physician, but like anything that they have to do, talking to the EMR, like talking to different health authorities, talking to the hospital wherever they work, all of those things, just covering them with AI agents.
Mhm.
Amazing. Yeah, that's really exciting. I can't wait to be able to try out some of these tools, because in my position, I always want to make sure that I bring the best of the best to my physicians, and so I can't wait to see what you guys the finished product when it comes to ADA, because it's really, I can see so many use cases with a tool like that. Yes, EMRs are coming up with their pre-visit questionnaires and so on and so forth, but having something this dynamic as such as ADA that can be applicable in so many different scenarios is amazing. I mean, Aman, I know you might have to drop off at any time, but thanks for joining me. I just might have one or two more questions for
Yeah,
Zaire.
yeah, no, go
Yeah,
for it. I really
yeah,
appreciate
yeah.
everything. It's been great. Thank you for giving us this opportunity.
Not a problem. No worries. I'm sure we'll be in touch.
Yeah.
Thank you. Yeah, yeah, yeah. You too. So, Zaire, in terms of now, this is really more on the mindset. I know I was asking you before what you would advise people get into the field. Being an entrepreneur, I or very new to the game. I think about how do I go about sticking creating a goal for myself and sticking to it. And you're a physician and you're an entrepreneur at the same time. Do you have some sort of systems that you create around your daily habits that help you to stay focused and just constantly keep you innovate, like maybe you the times that you play soccer, that's where you have your most creative ideas, or it's 4 a.m. at night when you're texting Aman. I'm just trying to understand like what your system is that it's helping you to stay
Yeah.
creative. And yeah.
I think first, like I'm not an expert. Like I think I'm learning as I go, and there's a lot of things I don't do well, I would say. So that's one.
Yeah.
Like recognizing your weaknesses and being able to kind of delegate.
Yeah.
I think that's very important. I think for me, like a strength and a weakness too, honestly, it's both. Is that by nature I'm like very chaotic and disorganized, and I like that environment.
Yeah.
I don't like structure, I don't like organization, even though a lot of times it's good, you
Yes.
need it.
Yeah.
Um, but yeah, like I enjoy it,
Yeah.
which is odd in medicine
Yeah.
because like when you're doing clinical practice, even like going through medical school and
Mhm.
residency, I think most people in medicine are very organized and meticulous.
Yeah.
And I try to be, but that's also, not my strong point. So I don't know. I feel like that chaos allows for a lot of creativity and a lot of ideas.
Yeah.
And then I have someone like Aman who is maybe more organized, structured,
Okay.
to kind of balance that out a little bit.
Yeah.
Um,
And that
so I think that,
complements.
yeah, yeah, compliments. I think that's again coming back to the first point, like recognize your limits and your weaknesses and just
Yeah.
kind of how do you solve that as a problem?
Yeah.
What motivates you? For me, it's family, it's kids.
Yeah.
And then just try your best, be
Yeah.
okay with failing, take
Yeah.
risks, the usual stuff. I don't know. Yeah.
Absolutely. No, I hear you. I think it's there's so many different paths that you can take to achieving your goal, right? Some of them are very commercialized or so much on the internet or social media, and building all the systems and routines and so on. I hate routines, but sometimes I stick to certain routines because I know
It's good for
what
you.
yeah,
Yeah.
exactly, what it allows me to do, right? So
Yeah.
I completely agree with the fact that sometimes just leaving that room for chaos also encourages some level of creativity.
Yeah.
But no, thank you very much. I mean, if physicians who are watching this, they want to learn more about your journey, I don't know if you write any newsletters or blog where we can just learn more about the product or a demo. How do we find
Yeah. So like demo of the product and for Scribeberry itself is we have like a calendar link that I can share.
okay.
So it's just cal.com/Scribeberry and people can book demos, meets with us,
Yeah.
whatever they need.
Yeah.
Me personally, I don't really write much. Like
Okay.
uh, I don't know. I don't.
Yeah.
I,
I'm
I'm
too
more
busy.
like a private person that way. Like I don't. Um,
Okay.
But happy to like connect with people, always if
Okay.
they email or want to chat,
Okay.
message me on LinkedIn,
LinkedIn. Okay.
whatever works.
Okay.
Yeah, happy to share always. Yeah.
Perfect. Perfect. Yeah. I mean, I'm sure we're gonna reschedule a meeting just to talk about Man United and where they're at
Yeah.
right now. But
We should play some FIFA, you see.
Absolutely, absolutely. I'll be connecting with you shortly to do that. But I'm gonna
Yeah.
leave links to your calendar invite and links to your website and so on in the description. But again, thank you so much for joining me today to have this conversation. I think it was great, and I think anyone watching this would have a bit of an insight of your product and your vision, and where you're trying to take to how much innovation is within your product and where you guys are trying to take this product to, and not just being in a space where it's super competitive and you just want to be part of the race. No, you're trying to stand out and say, hey, we're here to provide value, which is multiple features for a really affordable price that is all about efficiency. So again, thanks again, and I'm sure we'll be in touch. Okay.
Awesome. Thank you, Seal.
No problem.